Hi there, welcome to Little Piggy's Foot Care. My name is Amanda and we are on a journey in a car where I am not driving. Notice my hands are off the wheel and I'm not screaming they're going to get in a car accident. So I wanted to share with you a few things about diabetes, because this month, November, is when we celebrate Diabetes Month. And Little Piggies has decided that we are going to be having 4 videos about diabetes. So there are three main types of diabetes. You have type 1, which usually has a juvenile, they used to call it juvenile diabetes, and it's because it has an onset of usually childhood, but it's 100% that you are going to end up on insulin. It's because the pancreas no longer produces insulin, so that's kind of a big thing. It is an autoimmune disease, and it is something that people can live very, very full lives with. However, they do have to regulate their blood sugar levels via insulin. There's just no other way. One is gestational diabetes, and that happens to women sometimes when they are pregnant, and it can come back later on in life, but during one or multiple of their pregnancies, they have had to either take hypoglycemic agents, or that they've had to be on insulin. And the third type is the most common, and that is type 2 diabetes, and that is an adult onset, almost always an adult onset. It is not when we lack insulin or lack our pancreas is still working. It's just our body cannot register. Somehow it has a miscommunication with insulin, and so we still get the high blood sugars, and there's different other things, but it's not necessarily insulin dependent. Okay, meaning that you don't necessarily have to use insulin. And the great thing about, the great thing about type 2 diabetes is you can affect it greatly with changing your diet, losing some weight, and exercising more frequently. Sometimes you can, if you're in that pre-diabetic stage, you can stay there for a very long time. If you don't do anything about it and you keep on going the lifestyle you're living, unfortunately, there's a good chance you're going to end up with type 2 diabetes. So, because this is Diabetes Month, and because this is such a huge thing, diabetes is one of the leading causes. Well, it's huge. Like, not just in North America, not just in Canada, but around the world, the number of people who are getting diabetes is huge high, and they don't necessarily know why. Packaged foods have been thought of, the introduction of sugar, a lot of too much sugar, too many carbohydrates. There's lots of different ideas why it may be happening, but it's still happening. And Little Piggy's Foot Care our goal is to help you prevent some of the complications that can happen with diabetes, especially in our feet and our legs. Okay, so I thought I'd peruse Diabetes Canada, which for those who need it, Google it, be part of it, because that's awesome. Diabetes Canada is a great resource to have. They're amazing, and they can keep you updated on what's going on, the new advances in treatment of type 2 diabetes, type 1 diabetes, and any information that you need, you can get there, which is why I went on there too. So some of the statistics I found kind of interesting is that 1 in 3 Canadians have or will have type 2 diabetes, and so that means that 11 million people today have diabetes. One person is diagnosed with diabetes every 3 seconds in Canada alone. So 1.5 of us, or people, will have type 2 diabetes and not even know it. And 6 million people live with pre-diabetes, which is kind of it's your wake up sign for saying it's your wake up sign. What is it? Wake up call. There we go. Wake up call to start doing something like ASAP, so you don't end up with it. So 6 million have it without knowing, and they are pre-diabetic. Half of those will develop, so 3 million people will develop type 2 diabetes if they do nothing. And so that's pretty intense. Certainly something that we need to get on top of, right? So for those who are wondering if you have, so I will be writing a blog sometime, and visit littlepiggiesfootcare.com for that. And you can view my Facebook page and Instagram, I think. But the things I did want to get across to you is, how do you know if you have type 2 diabetes? Well, there are a few kind of warning signs to look for. One of them is increased thirst. If you find that you are so thirsty and you just can't get enough, and you're drinking and you're drinking and you're drinking, and that's different from your normal, something to look at. If you're losing weight, not trying to. If your breath smells fruity, in your urine you'll have protein in the urine. It's usually something you won't figure out until you go to the doctor to check it out. Let's see, increased thirst, polyuria, and then polydipsia, I think it is. But either way, it's you're using the washroom a lot. You're going pee, specifically peeing a lot. Polyuria. No, yeah, it's urea. What am I thinking? Anyway, those are things to look at. And tiredness, increased tiredness. So, all things that are important to look at. So, with those in mind, those who are at increased risk are those who are older, like 40 years old. The youngest person to be diagnosed with diabetes, I think, was 11. Type 2 at 11 years old. It's just that's scary. It's really scary. Anyway, and yeah, so thank you for taking this trip in my car with me. I know it was a little bumpy, but it's kind of life, isn't it? You gets bumpy as we go along. So think about it, and always talk to your doctor. If you're not sure something's up, go to your doctor. Get a blood test. Ask them about your blood sugar. Ask them if this is normal. Get them to check it out. Right? I know in Canada it costs us nothing but time to go and get checked out. So thank you so much for popping on with me and staying with me during this journey.